Hello, welcome back to another video. In today's video, this is the MRI Registry Review. I have practice test questions and answers for the brain anatomy. Could you please like, share, subscribe if you would like more videos like this from me. Also check out the MRI Registry playlist that I have at the end of the video for y'all to click on. And this is just a breakdown of what is going to be asked specifically for the ARRT exam, since I do have my certification through them. But if you are an ARMRIT student, you can use this information too. It's pretty much the same thing that you are going to be asked, probably just in a different way. So as you can see, kind of like where it say procedures, that will give you about 57 questions that will be scored if you are like ART. And as you can see, neuro, that's going to have about 25 questions. So if you want me to make more questions on body and MSK, let me know down in the comment box. I already have several review lessons or questions on patient care, safety, physics. I can make more physics if you all think that you may need more help in physics. So just let me know down in the comment box. All right, so I'll get into the Q&A. The way I like to do my videos, if you are new here, I like to read the question, the answer choices. I'll give you probably 5 or 10 seconds to think about the answers, and then I will, let you pause or rewind the video if I'm going too fast. Thank you all. Let me know how you did at the end of the video. You can just put it down in the comment box for me. All right, so for question one, which anatomy structure is the arrow pointing to? A, cerebrum, B, cerebellum, C, pons, D, thalamus. All right, the correct answer is B, cerebellum. Question two, which anatomy structure is the arrow pointing to? A, cerebrum, B, cerebellum, C, pons, D, thalamus. All right, the correct answer is C, pons. Question three, which anatomy structure is the arrow pointing to? A, cerebrum, B, cerebellum, C, pons, D, thalamus. All right, the correct answer is C, pons. Question four, the most posterior lobe of the brain is called A, frontal lobe, B, sphenoid lobe, C, temporal lobe, D, occipital lobe. All right, the correct answer is D, occipital lobe. Question five, which of the following is the largest portion of the brain and is divided into left and right hemispheres? A, cerebellum, B, cerebrum, C, midbrain, D, pons. All right, the correct answer is B, cerebrum. All right, so if you are finding this video helpful to you, could you please like, share, and subscribe so that I can make more videos? Thank you. Question 6. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Carotid bifurcation. C. External carotid artery. D. Subclavian artery. All right, the correct answer is A. Basilar artery. Question 7. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Carotid bifurcation. C. External carotid artery. D. Vertebral artery. All right, the correct answer is D. Vertebral artery. Question 8. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Common carotid artery. C. External carotid artery. D. Subclavian artery. All right, the correct answer is B. Common carotid artery. Question 9. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Common carotid artery. C. External carotid artery. D. Subclavian artery. All right, the correct answer is D. Subclavian artery. All right, so question 10. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is C. Internal carotid artery. And also just make sure that you know if it's like very particular on your exam, know which one is your right side versus which one is your left side. Question 11. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is B. External carotid artery. Question 12. Which landmark does the common carotid artery bifurcate into the internal carotid artery and the external carotid artery? A. C1 to C2. B. C2 to C3. C. C3 to C4. Or D. C4 to C5. All right, the correct answer is C, C3 to C4. Question 13. Which imaging plane is shown below? A, axial. B, coronal. C, oblique. or D, sagittal? All right, the correct answer is A, axial. Question 14. Which imaging plane is shown below? A, axial, B, coronal, C, oblique, D, sagittal. All right, the correct answer is B, coronal. Question 15. Which anatomy structure is the red arrow pointing to? A, pineal gland, B, pituitary gland, C, thalamus, or D, thyroid gland? All right, the correct answer is B, pituitary gland. So contrast is going to visualize the pituitary gland better. Majority of the time, it is going to be ordered unless for some reason the doctor don't want it. Like if the patient is allergic to MRI contrast, or maybe the patient just in severe renal failure where they just don't want to do contrast at all. But majority of the time, contrast is ordered specifically for the pituitary protocol. Question 16. Look at the picture below. Which MRI brain protocol did this patient have done? A, IEC's protocol, B, pituitary protocol, C, routine brain scan, or D, seizure protocol. All right. The question or the correct answer is A, IAC's protocol. IEC stand for internal auditory canal, and it is used to look at the internal auditory canal for problems relating to hearing loss or dizziness. So just make sure you know what I have highlighted. That's very important. All right, so if you could please leave me a comment down in the comment box, letting me know which area of the test that you think would be more challenging for you, or that you would need more videos on, whether it's patient care, physics, anatomy. If you've seen my other MRI registry review videos, you know that I normally ask this, but a lot of people may be watching me for the first time, so I just wanted to give them an opportunity as well to let me know which area they think they'll need the most help on. All right, we'll get back into the video. I could have, I wanted to do just like a brain video because brain anatomy like is a big part of the anatomy that you will have to know because so many areas that we need to know for the brain. You know, you have your arteries. So that's why the brain anatomy is like more in depth. Question 17. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, anterior communicating artery, C, basilar artery, or D, superior cerebellar artery. All right. The correct answer is A, anterior cerebral artery. Question 18. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, basilar artery, C, left internal carotid artery, or D, left vertebral artery. All right, the correct answer is D, left vertebral artery. Question 19. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery. B, basilar artery. C, right internal carotid artery. Or D, right middle cerebral artery. All right, the correct answer is C, right internal carotid artery. How are you all doing on your arteries? Are you okay with them? Do you know the arteries in the head or the neck? Let me know down in the comment box. Like, are you answering them correctly? Or is it like challenging for you to know your arteries? I'm just curious to know. Question 20. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery. B, basilar artery. C, right internal carotid artery. Or D, right middle cerebral artery. All right, the correct answer is D, right middle cerebral artery. All right, so if you did make it this far in the video, could you put this little brain emoji in the comment section? I'll just, whenever I see it, I'll know how far you got in the video. So thank you so much for watching this far. And then also, I appreciate and look forward for your comments about this. Question 21. Which anatomy structure is the arrow pointing to? A, cerebrum. B, cerebellum. C, corpus callosum. Or D, thalamus. All right, the correct answer is C, corpus callosum. Question 22. Which anatomy structure is the arrow pointing to? A, first ventricle. B, second ventricle. C, third ventricle. Or D, fourth ventricle. All right, the correct answer is D, fourth ventricle. Also, could you all comment below if you are a CT tech as well? So whenever I was doing my MRI training, I was like a CT tech first. So I already knew the anatomy of like the head and the brain because I had to take like a sectional anatomy course for CT and MRI anatomy. So even though I was in school for like CT, it was they was quizzing me on both CT and MRI anatomy for my sectional anatomy course. So I know like if you are either a CT tech, it will probably be a little bit more easier to know your anatomy. But then sometimes you don't even have to be a CT tech. It just comes easily. Um, Sometimes for people to know like certain anatomy, sometimes brain is easier for someone to learn over like MSK things. So just put it down in the comment box if you are a CT tech, cross training into MRI, if you are an X-ray tech and you're trying to learn your anatomy, or if you are like an ARMRIT student and this is the first time you're like really having to know your anatomy. Question 23. Which lobe is the most anterior portion of the brain? A, frontal lobe. B, parietal lobe. C, temporal lobe. Or D, occipital lobe. All right, the correct answer is A, frontal lobe. Question 24. Which gland secretes the hormone melatonin? A, pineal gland, B, pituitary gland, C, thymus gland, or D, thyroid gland? All right, the correct answer is A, pineal gland. Question 25. Which gland is responsible for producing and secreting hormones such as prolactin? A, pineal gland, B, pituitary gland, C, thymus gland, or D, thyroid gland? All right, the correct answer is pituitary gland. Question 26. Which imaging plane best demonstrates the pituitary gland? A, axial, B, coronal, C, oblique, D, sagittal. All right, the correct answer is D, sagittal. Question 27. Which anatomy structure is the arrow pointing to? A, ethmoid sinus, B, frontal sinus, C, maxillary sinus, or D, sphenoid sinus? All right, the correct answer is B, frontal sinus. Question 28. Which imaging plane is shown here? A, axial, B, coronal, C, oblique, D, sagittal. All right, the correct answer is D, sagittal. I'm sure most of you all probably know your imaging planes like axial, coronal, sagittal, but just for someone who, have not really had that much training or experience with recognize their imaging plane, I still just want to throw it in so that someone else can know. All right, question 28. Which anatomy structure is the arrow pointing to? A, medulla oblongata, B, pons, C, spinal cord, D, thalamus. All right, the correct answer is A, medulla oblongata. Question 29. Which anatomy structure is the arrow pointing to? A, pineal gland, B, pituitary gland, C, pons, D, thalamus. All right. The correct answer is B, pituitary gland. Question 30. Which anatomy structure is the arrow pointing to? A, anterior ventricle, B, lateral ventricle, C, second ventricle, D, third ventricle. All right. Moving right along, the correct answer is B, lateral ventricle. Question 31. Which anatomy structure is the arrow pointing to? A. Medulla oblongata. B. Pituitary gland. C. Pons. D. Thalamus. All right, the correct answer is D. Thalamus. Question 32, almost done. Which exam was performed in this image? A. MRA brain. B. MRA neck. C. MRV brain. Or D. Routine brain scan. All right, the correct answer is MRA brain. All right, so that's it. If you made it to the end of the video, please like, share, and subscribe. Click on one of the videos up here on the screen so that you can keep contact or just keep looking at my MRI registry review videos and playlists. Also, put the brain emoji in the comment box if you made it this far in the video. Once again, thank you all for watching. Leave any comments that you would like. Let me know in the comment box if you did find the video helpful. This is pretty much just like a basic and overview because brain is something important that you need to know. But other than that, thank you all for watching and I will see you all in the next video. Bye.